Swami, the viewer needs to know, today's date is June 25th, 2013.
Mm.
You came to see me for the first time in January of 2010,
Correct.
correct?
Correct.
And Maya is here. You're one of Swami's followers.
That's right.
Yes? And when you came to see me, would you say it's safe to say or accurate that you were on death's door?
Yeah, I'm perfectly all right now.
Now you are, but then,
At that time, because I was not so, I was weak, but mentally I was not weak.
mentally you were not weak, but
Yeah.
you could barely get into the office.
Oh, yeah, that is the time because,
He could barely walk.
yeah, that is true. That is true. And then
You had-
the treatment helped very much to recover, and I followed all through this 2 years, more than 2 years, this all the instruction and the direction you gave us to follow, so that we are trying. I'm trying my best to follow it.
I'm so happy you did. So in other words, you've been following my dietary instructions, you've been taking the nutritional supplements,
Yeah.
and for a period of many months you were coming in here and getting IV therapy,
Yeah.
which you got better so fast that you said, I don't have cancer anymore. You remember that?
I remember, but then I didn't know about that, the other part.
Right. You said, I don't have cancer, and I couldn't get you back in. The liver cancer, you had metastasis to your liver, huge, 11-centimeter metastasis to your liver, in addition to a problem in the cecum. And you were bleeding. You even needed blood transfusions. You remember that?
Yeah, 3 times.
And then within 4 months, you said you were so much better, you didn't want to come back in. I don't have cancer, but you continued to bleed, and you needed transfusions.
Yeah.
Right?
Correct.
And then a year and a half, less than a year and a half after you started with us, it was in May of 2011, the scans showed that the liver metastasis had disappeared.
Totally.
Totally disappeared. And then
Yeah,
the
totally.
liver metastasis disappeared, right?
Totally.
Totally. And then I sent you, I told you to go get the primary one removed surgically,
Surgery.
which you did, and the surgery went very well.
Oh, perfectly.
And the surgeon happened to call me afterwards and said he couldn't believe how easy that operation was. He could just scoop out the cancer.
Yeah.
And then ever since then, the tests have shown that you're cancer-free. Is that correct?
Yeah, correct.
What are you doing now for follow-up for the cancer? Are they doing any tests?
No,
Nothing.
nothing.
Okay. But the last one was about 8 months ago, I think. Was it not, Maya?
No, we haven't had a blood test for over a year.
Okay.
So
But
nothing.
but you're gaining weight.
Yeah, gaining weight.
You're climbing mountains. You're doing all your spiritual duties.
Oh, yeah.
You have abundant energy
Yeah.
compared to when you needed assistance just to walk in my door.
Yeah,
Right?
correct.
Okay. May I post this on YouTube?
Yeah.
Thank you. And you, Maya?
Sure. No
Okay. Maya, what are your comments on what you saw with Swami's recovery?
Well, I'm convinced that the diet and the supplements and the IV therapies helped Swami recover from cancer.
Would you have believed that somebody with that late-stage cancer, we call it terminal cancer, could have had that kind of recovery?
Well, now I believe, but we kept coming back. We had faith somehow.
But you
No.
wouldn't have believed it before.
No, because the doctors, they said that's it for Swami.
Oh,
6 to
that's important. The
6 to
doctors said they had given up.
6 to 8 weeks to live.
6 to 8 weeks to live. You remember that, Swami? They
Yeah.
s-
And I challenged them that I'm not going to die.
So,
That's true.
so the doctors had given up. There
Sent
was
him home
there
to
was
die.
nothing they could do. They sent him home to die. And I was just telling Swami before you came in, this is important to me because in this state right now in California, treating cancer other than what they do, chemotherapy, radiation, and surgery, is a crime.
I do believe, and I am ready to stand in support of you in the court.
Thank you, Swami.
Same with me.
Because essentially what the doctors said is, we can't do anything for you, go home and die, but we're going to make sure you can't get treatment anywhere else because we're going to make it a crime for anybody to treat you. That's essentially how it stands.
This is true, and they also refused to give him chemo or radiation because they said he was too weak to withstand it.
Say that again.
The doctors at Kaiser said that Swami was too weak to withstand chemotherapy or radiation.
So they weren't
So
even going to do
They
it.
refused treatment for him.
Okay. And what do you think of the fact that here they refused treatment, he was too weak to get it, but to get a different type of non-toxic treatment is a crime? How does that strike you?
It's completely wrong. It's completely...
And
it's
I read a few comments about the way that hospital, what is the name of the hospital?
Kaiser.
Kaiser, I mean, treated. Of course, I'm very grateful to them because they are the first person to detect the problem with my whole system.
Yes.
But regarding the treatment, they never did anything, and they never could give any positive suggestion. That is, I'm very sorry to tell about these affairs, the way they deal with a patient, in emergency room and all these things. I have to force myself to come away, and I have to force myself. But I found that cannot do anything. On the other hand, the way they are treating me and all these things, I was becoming weak every day, and what is the reason I don't know.
So, in other words, you're happy that Kaiser detected it, but you're saying there was absolutely nothing they could do.
No.
Nothing that
No,
they
and-
offered you except to go home and die.
Guy, and I'm to force myself to come away.
That was 3.5 years ago.
That's right.
And to the best of our knowledge now, you are free of cancer.
Right.
And this was an absolutely marvelous case to me of what I call integrative treatment. He got supportive therapy from us. His immune system turned on. His own body was able to get rid of the metastasis. And then we did suggest conventional surgery to take out the primary.
Right.
And the surgeon called me and he told me he was in shock after the surgery that not only was it so easy to remove, but there was no trace of metastasis on his inspection.
And 3 times he asked his assistant to to check, to test it, whether there is any trace of cancer or not.
Metastasis.
Yeah, 3 times. So
3 times.
3 times his assistant, the person, the doctor who does this test, told him that 3 times that it is all free.
So I think the key as well was that we got Swami started on the supplements immediately after coming back from Kaiser. On the supplements.
Yes.
So
He was so weak. He wouldn't have been able to get in the door. He was so weak.
Right.
We got him on supplements.
couldn't get out of bed.
Couldn't get out of bed.
No, couldn't get out of bed.
And this is how the Kaiser doctors left him.
Right. And he came back home in an ambulance on a gurney. And we had to wheel him into bed. And then we started him with the supplements that you recommended.
And I hadn't even seen him at this point.
Exactly.
This was just to get him strong enough to walk in my door.
Exactly. So that was about 1 month of taking supplements and being on the proper diet, and no sugar.
Right. And then after a month of that, he was strong enough that he walked in the door, and at that point we started working with him with IV therapy, which was not uncomfortable, was it, Swami?
No, it's comfortable.
Very comfortable.
Yeah.
Thank you.
And then only one thing that I must give thanks to you for at this particular treatment, that water, that to drink water after adding a little baking soda, so the system will be converted into what is called not acidic but the
Alkaline.
alkaline.
And
So
that-
I feel very much that is helping even to today, very much.
You're still taking the baking soda.
I am taking.
I love to hear that. We know that cancer thrives in an acid environment, and there is good literature that's come out even since I saw you, Swami, that alkalinizing in baking soda reduces the risk of metastasis.
Yeah, you told me
Yeah.
that if the system becomes non-acidic, that in that system the cancer germ cannot survive.
Right.
In course of time, they will be eliminated or something will happen.
Okay.
I do believe it.
For the viewer, I also want to add that compared to the still photographs that I attached to this, Swami today walked in accidentally without his dentures. So he doesn't look exactly like he might have looked in the pictures when he had his dentures. Okay?
Okay.
But he's quite healthy otherwise, and even though his mouth might be sunken in a little bit from the lack of dentures, that's what it is.
This is the right Swami.
Right,
Same
right.
Swami.
It's still the same Swami.
Yeah.
Right.
Okay.
Swami A, as we call you, thank you so much for coming back.
Yeah,
and
and I
gracing
also
me.
give you support your view about going forward to help so many lives who are suffering from this particular disease, cancer, in general. So there should be something to, should be done to save the lives of so many people.
Thank you. You're 80 years old now, correct?
Correct?
And when the cancer was diagnosed, you were 76.
Maybe.
That's right.
6 weeks to live. He's now 80 years old, gaining weight, climbing mountains, and attending all of his spiritual duties.
That's correct.
Thank you both so very much.
Thank you, Dr. Rowan.
So that was the Swami is waiting for you.
Okay.
I tell you something that they are following, very seriously and religiously your instruction in getting and drinking my water, drinking water. I add all the time baking soda, and it is helping me immensely. Besides this, I'm taking the supplements also. The number of the supplements you recommended, I'm trying my best to take, regularly. So that is, this too, I think, is working well on me, and I'm very strict with my food. Very food. Whatever you gave instruction, I follow it. Plus, sometimes little, you told me that sometimes I can go at little, drinking a little tea, and then add little honey, and not regularly, it is helpful. So that is where I am now.